Have you ever wondered what the BIRADS designation at the bottom of your mammogram report means? You're not alone. I'm Dr. Angelena Crown, a fellowship-trained breast surgical oncologist, and I get this question all the time. BIRADS is a standardized form of communication that radiologists use in order to classify mammograms and other forms of breast imaging and describe a clear plan on what should happen next. BIRADS comprises a numerical scale that ranges from 0 to 6, with higher values indicating a higher level of concern. BIRADS 0 means that the exam isn't finished. Maybe the radiologist wants to compare it with older images, or they need additional pictures like magnification views or ultrasound. BIRADS 1 is a negative exam, meaning that no abnormalities were seen and the likelihood of breast cancer is essentially 0. You just come back for routine screening in 1 year. BIRADS 2 also indicates a likelihood of breast cancer of essentially 0, but the report describes a classic harmless finding, like a cyst or fibroadenoma. It's the same recommendation: return for screening in 1 year. BIRADS 3 means that something is probably benign. Here the risk of cancer is greater than 0 and up to 2%, so still very low. To be cautious, radiologists recommend short interval follow-up, usually at 6, 12, and 24 months, to make sure that the finding stays stable. BIRADS 4 is where it gets confusing because the risk of cancer ranges from 2 to up to 95%. To help narrow it down, radiologists can use subcategories. 4A indicates a 2 to 10% chance of finding malignancy, 4B indicates a 10 to 50% chance of finding malignancy, and 4C is where it's more likely to find malignancy than a benign finding, ranging from 50% to 95%. No matter which subcategory it is, the recommendation is always biopsy because the only way to know for sure is to look under the microscope. With BIRADS 5, the likelihood of cancer is greater than 95%. In fact, if the biopsy comes back benign, we usually repeat it because the result doesn't fit with what we see on imaging. BIRADS 6 is reserved for when a biopsy has already confirmed a breast cancer diagnosis. From there, additional imaging can help guide treatment decisions. While the BIRADS system can be confusing, even for surgical residents, it's designed to give you structure so that you and your care team know the next step. Save this so that you know what your report means and share it with anyone who might be interested in learning about their breast imaging.